This is the often overlooked face of Sub-Sahara Africa today. Non-literate. 2 out of 3 people can't read or write in a way that lets them use information to improve the quality of their lives. They are oral learners where traditional values are communicated through trusted relationships. Rural. Over 250 million people, 62% of the PEPFAR target population, live outside the cities, making them hard to reach, physically and culturally, with prevention, treatment, and care information that could save their lives and their communities. It's in the rural area of Africa where HIV/AIDS has gained a foothold as it spreads from cities to the surrounding areas lacking in the money, the education, and the infrastructure to combat the menace.
One of the things I think, in my opinion, is that there are a number of people who contact the AIDS or the HIV infection in the city, and they go back home with their illness to receive end-of-life care in the villages and the small communities where they come from. And that is where majority of Africans live. But these villages don't have the modern infrastructure that is required to adequately take care of HIV, to make the diagnosis, provide drug treatment, and all the other healthcare support that is required for the management of an HIV-infected individual.
If the rural people of sub-Saharan Africa are going to be reached on a large scale with information that can prevent a largely preventable disease like HIV/AIDS, it's going to take an innovative new approach. An approach like that introduced in rural Nigeria by Voice for Humanity, an advanced technology-based program that is so effective in its simplicity that it can be deployed not only for prevention education, but to support and facilitate care and treatment programs as well. Voice for Humanity employs a digital audio device that can be the tool of choice for Africa's most difficult to reach population. Here's how it works. In an oral culture, information must be disseminated that way. With Voice for Humanity, it is, through stories, drama, music, developed by Africans for Africans. Only the technology and the instruction comes from the West. Information is recorded, then edited, compressed, and put on a chip. The chip is installed in an audio player like this. It's then distributed through a social network of trusted indigenous leaders who pass it on from village to village. Listening groups are formed among friends, family, and neighbors, such that knowledge moves virally without the need for vast external human resources and support structures. It is advanced, low-cost technology with 10 times the audio compression capacity at 10% the cost per hour of an Apple iPod, all packed onto a small, secure, plug-and-play chip. There are no moving parts to wear out, and it's not affected by the harsh sub-Saharan environment or by prolonged repeated use. Groups can listen together, or individuals can listen alone, anytime, anywhere, over and over. Unauthorized reprogramming of the player, for example pirated music, is not possible, and the chip cannot be sold on the black market because its design will not allow it to be used in any other kind of device such as cell phones, MP3 players, or cameras. There's no cost of ownership. Batteries are solar rechargeable and can last years. More than 100,000 devices have been distributed in Africa and across the Middle East in the last 2 years with virtually no technical failure. The technology has provided over 5 million people with over 50 million hours of in-home educational instruction. It's often preferred over radio since it can be played anytime, anywhere, and is not dependent upon someone else's schedule. And most important, it works. Funded by the Office of the Global AIDS Coordinator, Dr. Igo Ofodokun of the Division of Infectious Diseases and the Center for AIDS Research at Emory University led a team from Emory's Rollins School of Public Health to evaluate the Voice for Humanity program in Nigeria, the largest of the PEPFAR countries. They compared the communal impact between intervention villages who received the device and control villages that received the same content through standard HIV/AIDS training programs. The level of HIV knowledge in each community was measured using a standardized World Health Organization survey instrument. The baseline study showed about the same level of HIV knowledge in both communities. However, the intervention villages using the Voice for Humanity approach was nearly 5 times more effective in raising community knowledge than the control villages, where the same education was distributed through seminars, pamphlets, and train-the-trainer activities.
We found out that people who were exposed to the Voice for Humanity program were more confident, were 5 times more confident about their level of knowledge.
Sensitivity to the culture drives much of Voice for Humanity's success. In Nigeria, Christians and Muslims have worked together to develop content and implement programs. That sensitivity, combined with the cutting-edge technology, has been proven effective. 94% of the targeted intervention populations participated in listening groups in just an 8-week period. The Voice for Humanity intervention was significantly more effective in reach, knowledge delivery and retention, and communal impact than in the control group. During an 8-week period, 250,000 Nigerians were reached in their homes with 4 hours of education using just 4,500 devices. The Voice for Humanity program was on average 150% more effective at correcting misinformation about HIV/AIDS than standard HIV/AIDS outreach methods, and 600% more effective in retaining accurate knowledge about HIV/AIDS than standard outreach methods.
This approach could be applied to anything you want to educate people about. You can use the same approach to teach people about water purification, about agriculture, and this will be important because remember, most Africans are oral communicators. They learn by listening. They learn by talking to one another. So this approach of using this voice-based education recorded in the local language is applicable not only to prevention of HIV, to treatment of HIV, and also for the care of people who are living with HIV.
The technology is simple, and so is the mission of Voice for Humanity in this time of crisis when time is of the essence. Enabling non-literate and oral communicating peoples to access life-saving, life-changing information anytime, anywhere.